you.
Senator Baldwin.
Thank you, Mr. Chairman. Dr. Monarez, thank you so much for being here. Thank you for meeting with me in advance of this hearing, and congratulations on your nomination. As we discussed when we met, I have expressed serious concerns to the Secretary of Health and Human Services, Secretary Kennedy, multiple times, both before this committee and before the Appropriations Committee when he appeared, and multiple times in writing, about the firing of the entire staff of the Childhood Lead Poisoning Prevention Branch at CDC. This has left the city of Milwaukee unable to get the help they need to address a lead exposure crisis in the Milwaukee public schools. Just to give you a sense of the scale, 6 schools needed to close for remediation. 1,800 young school children were displaced. And when the city's health department reached out to the CDC, their application was denied because there was no staff left. It sounds, now the good news is it sounds hopeful that these employees are now being reinstated. In fact, the very day we met was the day that there was an announcement that some 400 plus CDC employees that were previously fired or let go were going to return. But they should have never been recklessly fired in the first place. And the president's budget proposes current funding levels for this program, but you can't operate a program without the staff, right? So, Dr. Monarez, if confirmed, will you immediately ensure adequate staffing within the Childhood Lead Poisoning Prevention Program and then reevaluate Milwaukee's request for assistance?
Thank you, Senator, for taking the time to meet with me in advance. As I've talked about, CDC is refocusing its activities towards preventing, detecting, and responding to infectious diseases and emerging threats. If I am confirmed as a CDC director, I will return to an amazing organization, and I will be interested in understanding how we can successfully.
Well, this is very specific. Will you assure that there's adequate staffing within the Childhood Lead Poisoning Prevention Program and reevaluate Milwaukee's application for assistance?
Yeah, this is a very important issue, and I'm glad that we're talking about it. I will look at the workforce that is aligned with lead poisoning in children, as well as other critical public health issues.
All right.
To make sure.
This is an easy yes or no question. It's fully funded in the president's budget request. They're trying to hire the staff back, I understand. This should be a priority. Are you willing to say yes, that you will assure that adequate staffing exists within the Childhood Lead Poisoning Prevention Program, which just a couple weeks ago had 0 staff, and look at Milwaukee's application for assistance?
So I will look.
Okay, can I hear that? Yes?
I will look at the staffing, and I will ensure that these public health priorities have the capacity necessary to deliver the critical services to the American people.
So I had followed up with Secretary Kennedy asking several very specific questions related to the operation of the Childhood Lead Poisoning Prevention Program, the status of appropriated funding for the program, and Milwaukee's request for assistance. I asked for a response to very straightforward questions, and I have heard nothing back from the Secretary. If confirmed, will you provide me with any requested information related to the status of the Childhood Lead Poisoning Prevention Program and Milwaukee's request for assistance in a timely manner, since it appears that Secretary Kennedy will not?
If I am confirmed as a CDC director, I will look into it and I will follow up with you.
Okay. Do you agree that women should have access to breast and cervical cancer screenings?
I think that breast and cervical cancer screenings are critically important, as I talked about.
In the president's budget proposal, it appears that CDC's cancer prevention programs are entirely eliminated, not moved to the new administration for a Healthy America. They are proposing, but gone, just gone. So the Cancer Prevention and Control Activities at CDC houses the National Breast and Cervical Cancer Early Detection Program. I have long championed this bipartisan program with Senator Collins. It provides cancer screenings to millions of women, including thousands of women in Wisconsin. I have serious concerns with the administration proposal to move longstanding CDC programs out of CDC. But if Congress directs and provides funding to CDC to continue a program, that absolutely needs to happen. If the program is lost, combined with the attacks on access to cancer screenings, included in the Republican reconciliation bill, women are going to be left without options to get care. So do you believe that CDC has a role to play in helping prevent breast and cervical cancer and provide screenings for women at risk?
Those areas are critically important, and if I'm confirmed as a CDC director, I will ensure that those programs are successfully transitioned and continue in other parts of the agency that are prioritizing these critical areas.
Even if the president's budget proposes elimination?
So I haven't been involved in the president's budget deliberations, but these are critical areas, and I will support making sure that the other parts of the agency that will be taking other broader public health measures will have my support and continuity of action.
Thank you for your indulgence, Mr. Chairman.